Aloha, my name is Dr. Nathan Ehrlich, and I'm a naturopathic doctor on Maui, and I wanted to follow up on my previous video on my introduction of naturopathic medicine into my life and the principle of Vis Medicatrix Naturae, which I elaborated a little bit in that video, but to give you a little bit of a reminder on what that is, Vis Medicatrix Naturae is the healing power of nature. It's one of the cornerstone founding principles of naturopathic medicine, which means that basically nature heals itself via regulating mechanisms of homeostasis. Now, homeostasis is the process by which both animals and plants alike, basically life, regulates itself for survival. This can pertain to pH, to electrolytes, to compartment pressure. All of these physiological processes need to be in balance and need to respond to an ever-changing environment. We've all been aware of our bodies healing itself, so this is not something that's just exclusive to naturopathic medicine, but it is in the common medical paradigm, is how we think of conventional medicine. It, at least in the 1980s, is not something that was readily accepted. When I was a kid on up until the early 1980s, when I became interested in naturopathic medicine, the common opinion in the medical community was that fever was somehow bad or dangerous and needed to be controlled. And this was representative of what is called allopathic philosophy, or allopathic thought. It is the model of medicine which approaches physiological events, which are homeostatic processes like, say, fever, inflammation, as processes that need to be controlled and reduced and eliminated. So we have antipyretics for fever, we have anti-inflammatories for inflammation, we have antibiotics for infections. When I learned that naturopathic doctors believed that fever was a natural healing mechanism and it was a good process, it made perfect sense to me. That is, of course, provided that it's not such a high fever that it would be life-threatening. Many systems of healing are constructed around this concept. For example, in hydrotherapy, fever is often augmented or it's induced to reach a physiological goal. So I was curious when I started naturopathic medical school about the therapies being taught for acute trauma being somewhat allopathic in orientation, even though the therapies themselves were natural. This was 1984, and at that time, medical and osteopathic doctors, chiropractors, physical therapists, sports trainers alike all used the RICE protocol for treating acute trauma. RICE stands for RICE, R is rest, I, ice, C, compression, and E for elevation. And the final goal of these modalities was to reduce or eliminate pain and swelling. Well, in short order, I had accepted that this is the approach. I didn't think too much about it. And even into my practice for the first 15 years or so, I implemented the RICE protocol for a lot of my trauma patients and injuries. And also during this time, I observed the getting worse first and then better phenomenon, which often occurred with body work and spinal manipulation. And after being in practice about this amount of time, say 15 years or so, I took a class with Dr. Rick Marinelli, who is one of our naturopathic doctors who brought great light to the field of prolotherapy and has since passed on. We love Dr. Rick and are very grateful for having been instructed and having had the blessing of gotten to know him as a great man. But this was the concept of prolotherapy, was that you stimulate the body to heal through deployment of inflammation. So you're actually using injections to create inflammatory conditions to get the body to send growth factors into that area. He stimulated my interest in regenerative medicine, which has led me to the type of practice that I have today, integrating lots of different elements which utilize growth factors from various different biologic agents. These growth factors are also a part of Vis Medicatrix Naturae, and they're responsible for the remodeling of new connective tissue which has been damaged from trauma. And it's very fascinating to me to be able to observe this symphony of events that occurs when the body heals from trauma. One event leads to another event, and that cascade ideally leads to the complete healing of an injury. Now imagine that the initial events that occur after an injury, such as swelling, inflammation, induration, pain, are all integral, or would be integral, in the stimulation of these growth factors. Then what would happen if, in our hopes of making an injury more comfortable by either taking anti-inflammatory medication or applying ice, that we eliminated the swelling and inflammation in the initial phase of the way the body would instinctively respond to trauma? I believe that the initial phase of inflammation is critical for an injury to proceed through to a complete healing. Now, in this situation, I'm talking about acute inflammation rather than chronic inflammation, which may be resultant to other factors. For chronic inflammation, there may be dietary or environmental factors that come into play, and this needs to be evaluated on a case-by-case basis. But I liken this to low-grade fever in patients whose vitality or lifestyle is suboptimal, enough to where the body attempts to create a fever to overcome microbial invasion, but it just can't surmount it. This can be due to many factors, but as in the case of inflammation, it is a good example of the body trying to heal itself. I find it ironic that the collective mind we humans possess tends to battle the innate wisdom of the body in regulating these homeostatic processes, body's defenses and self-healing processes. Now, this has actually been occurring with greater impact since the early 1900s, when the Flexner report was published, which fully established the allopathic philosophy in tandem with the newly born pharmaceutical industry as the de facto convention in medicine. If you like tracing historical events as they pertain to the way things are in the present time, you will learn a good bit to do a little research on this particular event in history as it pertains to modern medicine. Ultimately, in my 30 years of practice, it appears that there's a lot of truth in the adage that a lot of regenerative practitioners and doctors use when they say, if you want to create a chronic injury out of an acute one, ice it or take ibuprofen. So this is the advice I give to patients whom I've treated with some form of biologic compound. Just let it rest and let it go through the process it has to go through naturally. And sometimes resting and just honoring the pain is the best thing you can do. Masking the pain often leads to problems because you aren't aware of the signals that your body's sending you. Not to mention that opioid medications are highly addictive and have no curative benefits. As in most cases, you must see your doctor in the event of an injury to get a definitive diagnosis and an opinion of your need for care. But this time, maybe you can go see a physician who specializes in regenerative medicine and get their opinion. Okay. Aloha, take care, be well.